Hi, my name is Joni, and today I want to show you a self-treatment technique that can be useful for treating tightness through our inner thigh area. So I'm going to have you place the ball in between your legs just above your knee, and for comfort we're going to get a pillow between your lower leg area as well at the same time. So you may need to wiggle around a little bit or shift your weight forward or back to find an area of tightness or soreness. So once you find a spot that's tight or sore, it's important to wait there for 4, 5, 6 minutes in order to give ample time for our body to soften and release and to get rid of fascial restrictions. We can use our breath to help facilitate the process of letting go by breathing right down to where the ball is, so right to where we feel that area of tenderness or soreness. And as we breathe out, letting our body soften over the ball and letting our body sink into the table or the bed. So once we find an area of tightness, it's important to wait in stillness as opposed to continuing to roll or to wiggle, because while rolling can feel good, it doesn't allow the tissue to let go and release at a deep level. Therefore, it only gives temporary results. So to get long-term results, you actually need opening or softening in the fascial system, and that's achieved by waiting 4, 5, or 6 minutes for a full release to occur. It's important to pay attention to the intensity of what we're feeling on our body when we're self-treating, because if it's too intense, our bodies will brace or hold because it's perceiving that intensity as a threat. So even though we're telling ourselves it's okay and we're telling ourselves to relax, our body will still hold against that increased intensity. So we need to keep it soft and gentle so that our body can really respond to the pressure. So sometimes as we're self-treating, we find a spot that feels nasty and tense, and that's when we can work around that area or above or below it for a while. So once our tissue starts to soften, release, and let go, you can actually feel that in your body. You'll feel it as the soreness starts to dissipate, the tension starts to ease, and the pain starts to go away. So when it feels like there's just a ball in there as opposed to tenderness or soreness, then that tells you that your tissue has released fully and has let go, and you can move on and find another area to treat or another spot to treat. So once we've spent plenty of time here, letting it soften, release, and let go, then we can move the ball up about an inch towards our groin area. We're going to repeat that same process again, finding that area of soreness or tightness through shifting our weight a little bit or giving a bit of a wiggle. Once we find the spot that feels right to us, as in that's what our body needs, then we wait with it for 4, 5, 6 minutes, breathing into it, letting our bodies soften, giving plenty of time to achieve release in our fascial system to get long-term results. So just continue this process and repeat it as needed until you work your way up your upper thigh. So often it's easy to be just drawn to our symptoms or where we're hurting and treat those areas. And while that can be good, it is limited because so often there's tightness in other parts of our body that's contributing or driving our symptoms. So it's important to treat the whole area, to be thorough, and to be able to capture the root cause of the problem. So as you're moving along your thigh area, if you find an area that doesn't feel tight, sore, or tender, then go ahead and skip over that spot and move on to the next one. until you find the spot that needs treated next.